Welcome back to another section of Anatomy of Thoracic Wall, where our sole focus will be the intercostal spaces, muscles present there, neurovasculature of thoracic wall, and the diaphragm. So, talking once again about the openings of the thoracic cage. Well, there are numerous gaps that connect the thorax with other regions and separate the bones of the thoracic cage from one another. Well, there are apertures present at the upper and lower parts of the thorax, known as the superior thoracic aperture, connecting the thorax to the neck regions, and the inferior thoracic aperture, connecting the thorax to the abdomen. We have already discussed the apertures in the previous section. If you have not watched it yet, do check it out. Now, there are some narrow and elongated spaces that separate the adjacent ribs. These are 11 in number and are known as the intercostal spaces. If we zoom in a little, each space contains a neurovascular bundle and 3 layers of intercostal muscles. Well, if you have a look, you will see that the intercostal nerves and associated major arteries and veins lie in the costal groove. They pass in the plane between the inner 2 layers of muscles. Now, in each space, you can clearly see that the vein, colored blue, being the superior-most structure, lies above both the artery and nerve. The artery is inferior to the vein, and the nerve is inferior to the artery, and often not protected by the groove. What can we conclude from this? Yes, the nerve is the structure that is at the high risk when objects perforate the upper aspect of an intercostal space. Now, you can memorize this order by the mnemonic VAN, where V is for vein, being the highest in the costal groove. A is for artery, and N is for nerves. The 3 layers of intercostal muscles I was talking about are the external intercostal muscles, this one, internal intercostal muscles, this one, and innermost intercostal muscles, this one. Anteriorly, each external intercostal muscle is replaced by the anterior intercostal membrane, which runs from the costochondral junction to the sternum. Costochondral junction, is the point where rib meets its costal cartilage. Similarly, at the posterior side, each internal intercostal muscle is replaced by the posterior intercostal membrane. Don't worry, I'm going to explain the intercostal muscles in the next part. Let me just introduce you to the various structures present in this figure here. So, consider it the lung. The serous membrane surrounding the lung is the visceral pleura. This one, the outer one, parietal pleura, is shown here, and lying in between these two is the pleural cavity. Well, deep to the intercostal spaces and ribs, and separating these structures from the underlying pleura, is a layer of loose connective tissue called endothoracic fascia. Here, and it contains variable amounts of fat. This is the superficial fascia, and here lies your skin. Well, that was just a brief introduction to the intercostal spaces. Let's have a deep understanding of the intercostal muscles, neurovasculature of thoracic wall, and the diaphragm. So, stick to the video till the end.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.